I'm Dr. Pete Economo, the East Coast psychologist,
And I'm Dr. Nikki Rubin, the West Coast psychologist.
and this is When East
Meets West.
So, as we come out of a pandemic, certainly a lot of us are thinking about our health, whether we've put on the quarantine 15 or if we're just a little bit more anxious around our health and our mortality. Nikki, what do you know about some health anxiety?
Oh, well, I've had it myself. I'll say I'm familiar with it personally. And it's obviously it's a pretty common, it's a pretty common concern, and obviously during the pandemic, even those people that I think haven't tended to have health anxiety, obviously, COVID has certainly, understandably and appropriately activated that. So, as the pandemic wanes, it is a useful time, I think, for us to start talking about like how to navigate some of those, scary thoughts that can show up about our health.
Well, as we did in season one, I mean, everything is behaviorism. And so I think that there's so many topics that we can cover. And then, but sometimes I still remain surprised for the topics that we have yet to cover. And this was one of them.
Yeah, well, yes. I mean, I think, it's just like we always say, like humans are very complex. So I just think there's just so many things. There's just so many things that
we're just rushing. I'm just rushing to it.
You're like, how are we going to cover all the things of being personal? I'm like, I don't know. I don't think we're going to get to them all, but I think we can make a dent here.
I felt that way during dissertation, where I go to the library and I look around and see all these books. And I'd be like, there's no way you could never read every book.
No, you can, no.
Never.
Never.
But that was like a nice thing to embrace during the practice of writing a dissertation.
Well, yes. And just like the practice of like, it's impossible to know everything, which honestly, I do think is a helpful segue into talking about health anxiety, because part of it is we can't always have the answers. Of course, the other side of that is learning to tolerate uncertainty, which, we have a whole episode on uncertainty, but comes up in everything.
Everything. So health anxiety is obsessive and irrational worry about having a serious medical condition. So it's like a basic way that we can think about it. It can also be called illness anxiety. It was formerly hypochondria, but hypochondriasis, but we'll get to that in a moment. I'm going to ask you to break that down. But how often do you say you see this in clinical practice?
That's a good question. I think, I see it with consistency. I would say it's not something that like, I'm like, oh, I haven't seen this in forever. It definitely comes up, because I would say even somebody that doesn't maybe reach a level, like a diagnostic level, right? Like,
well, hold on, break that down.
Yeah. So what I mean by that is someone that doesn't meet a criteria for a diagnosis of illness, anxiety disorder, or we'll talk in a moment. There's a differential between OCD can also have this flavor. There's a difference in how those present. Even if somebody doesn't have OCD or illness anxiety disorder, it's just people worry about their health. I mean, it's a natural, normal thing. And we
hold on. I'm going to stop you there for a second.
Yeah.
I'm going to challenge you. You always challenge me. I'm going to challenge you. Because
go for it. Yeah.
You just used worry.
Yes.
And so what I'm going to say is we focus on, or we are like, we prioritize, or we have a value of health. Mm-hmm. But that's probably part of the differential, is that when the worry comes in is when it might become a little bit more diagnostic.
I appreciate the challenge. You're going to laugh at what I'm going to say. Well, I was going to say, so on a spectrum, so I agree. I think you're absolutely correct that when it becomes, there can also be obsessions, by the way. So those are different than worry, right? So there could be intensive worry or obsessions where it starts to become diagnostic. However, even people that don't reach that level of like needing a diagnosis, right? It's not impacting their functioning. Everybody engages in worry behavior. And when there's something like you're saying, many, if not most people probably, value health, and we, most humans.
I don't like that assumption.
Well, I'm saying, it's kind of like saying let's say many people, many people value, if not, like if we were going to do a survey of again, just think from an evolutionary perspective, like valuing health, paying attention to one's health is a survival mechanism, right? To be aware of that. So yes, 100%.
Well, but survival would be different than health. Because I guess when I think of health, I'm thinking of well-being. And
So I'm saying it like, I'm saying it as the most broad, like it encompasses everything. So it's both
Like, what do you think about, like weight, heart rate? Like, what are you thinking about as you're thinking about health?
Everything related to functioning, like functioning well as in our bodies and our brains. So that includes everything, right? So it's like there's every little different nook and cranny of how you could behaviorally act in alignment with that.
Mm-hmm.
And so, and again, if I'm sort of maybe thinking about it from starting from like an evolutionary standpoint of like being a lot, like wanting to maintain being alive, right? And so is a foundational function of most living beings, right? Or of all living beings, maybe, dare I say. So worry behavior and this is what's different about humans compared to other animals, right? Because we have language, we can start to want to problem solve if something is wrong in our brains. Like if you feel something uncomfortable in your body, we're like, oh no, is something wrong? Like that's not diagnostic. That's just like what human brains do.
Right.
So that's what I mean about like, I would say in terms of who comes into my office with health anxiety, I see a version of that, both just like diagnostic all the way down to just like, most people have those types of thoughts at some point. Does that make sense when I say that?
No, it does. And I think we're probably saying the same thing. And I just want to create space that like, I don't know that everyone values health, because also like health requires time and money, so there's a ton of literature around, really higher socioeconomic status folk can really focus on health more easily.
Well, and so now I'm going to challenge you, right? So this is one thing. This would, for those of you who haven't listened to our values episode, that would be a helpful episode to listen to. So one thing, we say in acceptance and commitment therapy, and this is true, that, if somebody, everyone gets to choose their values. So if you don't value something, you don't have to value it. You really might not value your health. Right. However, oftentimes people misinterpret because they're not acting in alignment with something, that it's not important to them.
Right.
So, again, health is just about, like, when I'm saying that, it's just about being alive, right? About being, so the term well or wellness in this current era has a certain connotation to it. And I think that's what you're getting at, Pete. It's like, people don't have access to like all the things and all the healthy food.
I was actually only thinking about like food deserts. Like I was really just thinking about, right? Like I was thinking about access to healthy food, or even just the affordability of healthy food.
But that person might say, but it is important to me to be alive, right? To be alive. And so that would be a value of health. And how could that person act in alignment with their value given the limitations, right?
Exactly, right. And so I guess what we're trying to focus on is the health anxiety. So there are people who worry excessively or obsess around.
Yes.
I want to give us one stat before we link in, and then I'm going to ask you maybe to break down some of these diagnoses.
Sure, for sure.
But there was a study from Raleigh Health that found, and this is post-COVID, because I do think that really post-COVID, there's going to be an emphasis on health.
100%, totally.
Especially because
how could there not be, right? How could there not, right?
And what I'm thinking is, especially because we found that the virus didn't impact healthy people more than those that already had pre-existing or were less healthy. Right. So I think that's going to change people's brains to be like, well, if I'm less healthy, let me commit to that, because that might keep me alive.
That's a good point. That's a very good point. Yeah.
Right. So right now, this study found that 43% of the respondents had said that they were focusing more on their health following COVID.
Interesting.
Yep. So it said, and 49% said it made them more aware of their physical health, and 44% reported that it had made them more aware of their mental health. So, I think our field in the mental health is starting to wait for this kind of transition back and to see what people think. So let's just break down some of these diagnoses that the DSM-5 has highlighted for health anxiety.
Absolutely. So, Pete mentioned a few minutes ago that this term health anxiety, it was previously known as hypochondriasis. So, out in the world, people will say like, I mean, it's
Hypochondriac.
You're a hypochondriac, right? I was going to say it's not like the most common word. I wouldn't say like every person is walking around like saying that, but I would say maybe some of our listeners have heard that term, like I'm a hypochondriac, right?
Totally.
And that's really what that refers to, is like worrying about one's health. And it was a formal term in the DSM.
Yeah.
However, in the DSM-5, which is the current version that we use, it was changed to illness anxiety disorder.
Right.
So, illness anxiety disorder is, it's really focused on, basically like when somebody is worrying about their health. And, what can get a little bit confusing is that sometimes people kind of don't know I should say clinicians have difficulty distinguishing between illness anxiety disorder and OCD.
Yes.
And so we sort of like
OCD, obsessive compulsive disorder.
Thank you. So, both of them focus on health, and so sometimes you'll just like hear people talk about like, I have health anxiety. And then they're not really sure what that means. But basically like the easiest way to distinguish is that those people that have illness anxiety disorder fear that they have a disease, and that people with OCD that have a focus on health concerns fear that they're going to get a disease. So that's the difference. So, and that might sound a little bit like splitting hairs to our non-clinician listeners. But that's really the biggest difference. So
that's a huge difference though.
Okay. So it does sound like a huge difference to you.
I mean, well, I'm a clinician.
You're like, that is a stark difference when I hear Nikki describe it.
Well, and because I think some listeners are going to think about this of like, because it's not about death necessarily, and that's because that would be a whole nother type of fear. I do want to say that the ICD does include hypochondriasis still. So like we've talked a little bit about this, that the DSM-5 we use here in the US only, but the rest of the international classification system, the ICD, there still is hypochondriasis. And so go ahead and keep calling each other hypochondriacs if you want. Right.
That's wherever you are in the world, it's going to depend on what you want to call it.
People will know what that is.
Yes. Well, it's interesting that you're saying about death, because I think it is related to that though, because, even that, like the fear of having a disease versus getting one, it's like, well, look, part of that can be the fear of what would happen if you, and then obviously there's many different types of illness, so that not all illnesses result in death. So there can be the fear of like, having or getting an illness where you're going to be suffering in some way. It's like a fear of the suffering. There's also, but I would say the more common ones I hear is like a fear of like, for example, like getting or having cancer, right? Which is like, that's what I hear a lot. So it's like that type of illness, obviously people fear death, so.
Can I please. I think what's important here also for listeners is that, I don't know, maybe there's not a human, no one has ever said like, I hope I get cancer. So like I'm imagining that a listener is thinking like, well, then I must have this because I don't want to get cancer. Or I don't want to get something that's there. Where it becomes clinical is when there's the obsessions or the worry, so that they, right?
Yes. Well, it's so funny what was going through my mind. And this is we'll do a depression episode. It's like when you said, I don't think anyone's ever thought, I hope I get cancer. Unfortunately, there are people that think that sometimes, right? People that are struggling when they're really, people that are experiencing suicidality.
But I'm saying like in a general population.
Sure.
Right. Like if someone's healthy and stable, no one's like, I want to get sick. Because when I heard what was coming to mind when you were describing the differential diagnosis was like, I have a really good, colleague, and she's open about her experiences with cancer. And so, I think it's like, I respect them so much because now her husband's going through it. And so she's been through it 3 times. Now her husband's going through it. And so when I reflect on their experience, I'm just like, wow, what would I do? Like the selfish me is like, how would I manage this?
Right.
Because you just don't know until you're there.
Right.
And so
that's right. Well, I think what you're getting at, and this is where, when it starts to become like diagnostic, or another way of saying is like impacting someone's functioning, is look, what Pete's describing is anybody would have can have a worry, right?
Yes.
It's like what would happen, or will I be okay, or which is the brain's way of trying to problem solve something that's
Yes.
not solvable, which is uncertainty, which is the future. How would I tolerate this? Would I suffer? Like, what would the outcome be? And every human being engages in that behavior. Where
Yes.
it starts to impact one's functioning is when that worry behavior becomes so like consistent that someone's anxiety is reaching levels where they're not functioning well, or if it's OCD, and we've talked a little bit about this before too, they're having obsessions, which basically means you have an intrusive thought that thought alone reaches on a scale of like 1 to 10, your anxiety shoots to like a 9 as soon as that comes in. So, I'm guessing when you have that thought, Pete, your anxiety is probably not a 9. Like maybe that's an uncomfortable thought. Maybe it's like a 3 or something like that. And if you kept worrying, you'd get more anxious, right?
Well, that's where the behavioral science comes in, because it's such a vicious cycle.
Yes.
And that's why we have all this research with chronic illness, where what you need to do is break the cycle, because the more you think about and obsess around your body, I guess that's also a differentiation of somatic symptom disorder, where people psychosomatically, and people, I have found, I don't know if you've seen this, but clients or patients, they respond to that in such a defensive way. And so the way that I always explain that is somaticism doesn't mean it means it exists. It just means that the origin or the epidemiology of it is unsure.
Right.
We're uncertain.
Right.
And,
absolutely.
So people feel what they feel, but the brain can create it. So like if and I ask, I'll ask clients and, maybe for listeners, like just think about your foot for this moment. And if you think about a pain in your foot, you might be able to have just felt the pain in your foot. You may have just felt something.
Well, and actually, I think that's important I'm glad that you're bringing that up, because I think that's also important to say when talking about, this umbrella term of health anxiety, either illness anxiety disorder or OCD with a health focus, or, just general worries, is that, we feel sensations in our bodies all the time, like odd sensations. Those can be caused by, like, again, I don't know, like there's a weird itch on your body somewhere, your stomach's upset. It could also be any emotions we experience. Emotions also all have hardwired physiological sensations attached to them. So we're feeling sensation all the time. And then when we start to focus on them, right, and like over focus, I should say, right, over focus, and then begin to try to problem solve them. What is that? What does that mean? Am I sick? Do I have an illness? Am I going to get sick?
Am I going to die?
Yeah. Well, what's interesting is then anxiety starts to grow, and guess what shows up with anxiety? More physical sensations, right? This is actually how, we need to do an episode on panic. Actually, that's actually how panic attacks happen. So the misinterpretation of bodily sensation. So it's messy in there. Our brain, it's messy in there.
It is messy. And before we end, I just wanted to bring in a little bit of the Eastern tradition, because I don't know that, you and I can get just so stuck in the behavioral science. And I think I can do it quickly, because, most of our listeners are familiar with the Eightfold Path and the 5 precepts. So this idea of just no killing and, refraining from misuse of sexual misconduct, things like that. Overall, anything in the Eastern practice is really around, full body health and cleansing. And so one thing I'll say is, like, we don't want to distort your mindfulness. And so like any kind of substances, certainly like, alcohol or drugs, and certainly some foods that can like distort your mindfulness and your clarity. You want to refrain from that, because the ultimate goal is just to create, clearness. Also, many cultures in the Eastern practice, commit to like a healthy living. So there's meditation, which has a direct impact on health. There are certain cultures within China, for example, where they don't have some of the illnesses that we have. They don't even have the words for them. They don't have some of the cardiac issues we have, because they're just committing to this meditation, and then to the also healthy eating, or even like a vegetable based diet that can really help towards this health. So I think, go ahead.
Well, I was gonna say, I think that's really helpful. I mean, obviously, I'm always learning a lot from you about this, especially with the Eightfold Path. I think that's all really important and interesting. And the thing that I was actually thinking a few minutes ago about, like, what I was wondering, like, what's Pete going to say about this with regards to Buddhism, is if we go back to this idea that health anxiety is about, often it's like a fear of having a disease or a fear of getting a disease, which I was saying is really about a fear of suffering some way, or a fear of mortality. I think that's really interesting in terms of like what the Eastern practices would have to say. And I'm really curious what your thoughts are there.
Well, it's mostly what I hear in that is the attachment to this life. And that's what we would want to try and diffuse from is like, for me, it's like if I don't like flying or if there's something that I'm afraid because it might lead to panic or discomfort, that's still attaching to my moment, like feeling in this life.
Yes.
And so part of the Eastern practice is that, our karma or our rebirth is what allows opportunities, to kind of grow and to learn. So, potentially we're learning from previous life. So it's about non-attachment. So what I'll end with is just to think about and ask listeners just to think about, what is it that you're committing to in terms of health, recognizing that having thoughts around fears of health is normal as well, but just recognizing to diffuse from any kind of obsession and worry and see, are you willing to embrace the discomfort that is living and suffering?
This has been When East Meets West. I'm Dr. Pete Economo.
And I'm Dr. Nikki Rubin. Be present, be brave.
This has been When East Meets West. All material is based on opinion and educational training of Drs. Pete Economo and Nikki Rubin.
Content is for informational and educational purposes only.